Sir, in fact, what you did in touching these victims in all of these counts was ungloved. Is that correct?
Yes, Your Honor.
And it was not for any medical purpose. Is that correct?
Correct.
It was for your own purpose. Is that correct?
Yes.
And in fact, it was against medical protocol. Is that correct?
Yes.
Do you understand that in the plea agreement and what we've put before this court today, you are waiving any defenses that your actions were for a legitimate medical purpose?
Yes.
And you have initialed each page of this plea agreement, is that correct?
Yes.
And you have signed your signature to the back of it?
Yes. I'm so horribly sorry that this was like a match that turned into a forest fire out of control. And I pray the rosary every day for forgiveness for I want them to heal. I want this community to heal. I have no animosity towards anyone. I just want healing. It's time.
Yeah, wow, right.
Now,
Okay.
what I want to talk to you is kind of go back to that situation. Sure. And I know that you guys had, papers on this, talked about maybe redoing some practices and things in relation to that. Reference that situation. What do you recall about that investigation?
That's had concerns over the form of treatment that I was doing, and that I talked about having to do the reasons why I did it. From a manual medicine standpoint, and there was a student that was in the room that had to leave to start because I was behind. We need to start another patient, and so we're like, always have another person in the room.
Right.
You know what I mean? And I've been trying to adapt my techniques so we won't get into the same situation.
Okay. What practices have you changed in response to
I've been trying to have people in the room,
okay.
And trying obviously not to get into that same situation. You know what I mean? Like, has there been another complaint? I'm just like confused right now.
Well, we're kind of seeing what things have changed, what practices.
Okay, yeah. So I'm trying to do things where the difficulty is with the hands-on is I'm trying very hard to do things where I'm not being nearly as invasive, but it compromises things. So I am trying to modify that, and having students there and having family members there, and I document in the chart, so-and-so's in the room, so my documentation's changed. I'm trying my best to do it over close, and that's sometimes the hard thing is the tightness, it's like the close gets in the way, but so I'm very, there's not a day that goes by that I don't think about that, because that was a very scary thing, in my life, obviously. So, and I don't want to get into that. So I was like, oh my God, what happened? Like my heart is hurting. It's like, what the heck? You know what I mean? So, I hope, that I've made the appropriate changes, because it's, and I've done a lot of education. I'm really trying hard at educating so that and I always thought I was good at educating, but I'm trying to educate even more.
What do you mean by educating?
Explaining what we're doing.
To the patient?
To
or
the patient,
others?
family, exactly.
All right. Have you had any instances where there hasn't been anyone in the room for an exam since that time?
There'd be some on occasion, of course. You know what I mean? That just is the way that with medicine is now. It's difficult. You know what I mean? So yes, that has happened.
And what circumstances cause that to happen?
The patient is an adult, like she was too. But again, when I'm doing that, I'm trying not to do those techniques. You know what I mean? So, but I'm trying to, really trying to explain things. And I haven't had any complaints, you know what I mean?
During that technique, though, has there been situations where someone's not in the room?
I would probably, who's a doctor, you know what I mean?
You do that technique on?
She said it saved her career, you know what I mean? So she was
Can you explain the technique? I know bits and pieces, but I know.
And I sent her videos, too. I lecture on this. That's the thing that's frustrating. It's the sacrotuberous ligament, it runs from the pubic symphysis, the falciform process. It's like the pelvic floor. Okay, and you want to understand the stuff. So you're really coming in, like the way to describe it, even in some of the videos is, it's like you go towards the labia and go lateral. So you're going in and apart. Okay, and then there's muscles that attach to the ligament, and so as you're treating that, you can feel the release, and that's a great teaching thing too. It's like I have the student feel their rib cage, okay? And then I go and I release that, and they're like, oh my God, what did you just do? You know what I mean? Because they can feel that effect, from the way that the costal muscle, the costal stress runs down from the rib cage into and entwined in the.
Larry Nassar performed osteopathic manipulation, which involves the use of hands to move a patient's muscles and joints with techniques that include stretching, gentle pressure, and resistance. Nassar maintains he was performing legitimate medical procedures, although it seems there is more to that.
Sacrotuberous ligament,
So when you're doing that, and you said you look for the release, what are you feeling? Like what does?
You feel tissue tension.
Okay.
Tissue tension changes. It's all about tissue tension. Right? And so you're trying to, like if I pull on one part, you know what I mean? Like you can see how that affects another part.
Right.
So it's the same thing like a run in the pantyhose or something like that. Like one pull here can affect, and we talk about triplaning and fascial releases where, say if I rotate, extend, and back, you know what I mean? That like wringing out a towel. You know what I mean? So there's, you may have to go clockwise, counterclockwise. I always talk about the different vector forces to make the effect above. You know what I mean? So it's a three-dimensional, I call it triplane, but like a three-dimensional effect to it, because it's not just that simple. You know what I mean? So.
Gotcha. Okay.
Larry continues to blabber. At this moment, he seems comfortable since he knows that his position as a doctor can hardly be questioned by anyone, let alone the detective.
Now, how long have you been doing this technique?
I have video from 30 pounds ago, from like the 1990s. I'm trying to remember. It would have been in the 1990s. You know what I mean? Like early 1990s.
Right.
And I've made videos very clear. And I've lectured. Oh yeah, and I've lectured.
Are those online anywhere?
They're on my G drive, like I said, that I've sent. You guys should have all of that.
Dropbox. Or something.
Yeah, it might have been Dropbox then.
Back then, a few years ago.
Yeah.
So how would a patient be laying to get that treatment?
Prone, and then they're laid prone, and then you're doing that. And then I can do it seated. I talk about doing seated. I can do it standing. I can do it supine. So yeah, you can do. But
would they be on their side?
On their side?
Yeah.
Yeah, you can do it on the side too. I mean, like I show them in all the different directions, but it's rarely on the side. It's more if I'm doing something on the side, that's more for the SI joint. That's the SI joint.
What's the SI joint?
Sacroiliac.
Okay.
Right here. So that's where I might be like lifting. You actually sometimes like lift the hemipelvis.
Okay. And so where on their body would you touch the
Your
blood?
ear would be, if your hands are like this, you know what I mean, you could be actually holding that, like, this would be up towards the back, and this would be up towards the pubic symphysis, and you would could be like a U shape, and you can lift and shift from that position on the sideline. Generally, with the sideline, that's the lift and shift, and the coccyx, you know, if there's a coccygynia, you know, problem, then sideline, you know, can be treated.
Like if somewhere on the side, you wouldn't be doing the same
There'd be an alteration. There'd be a variation. You got to adapt, like just like standing. You know what I mean? Like, so you change it because of the three-dimensional vector forces. Depending upon whether what position they're in, it's going to have a different effect. So normally you try it one way. If one way doesn't work, then you try to seat it. You know what I mean? Because of the way that you can affect. And I try and teach them if it works. I've taught a lot of patients how to do it themselves.
Okay.
You know what I mean? Like self-treatment. Like, okay, I told them it's like giving themselves a hand wedgie. You know, it's like reach and pull, reach and pull. Like you're picking a wedgie, you grab, and then you pull off to the side, or you pull front, or one of those three main vector forces is.
Okay.
Coccyx, problem. You know what I mean? So if there's a fractured coccyx or a coccyx disorder too, so that you can come perianal because it comes up. When you have the pelvic floor attachments, but you can come to the pubic symphysis and also towards the coccyx. You know what I mean? So it's your lift, I call it the lift and shift, when you're doing that, So that's a very common to do one side or the other, and that's the straightforward. So like if you're here, here, or here, there's three different vectors, and that would be the straight vector. Like if I'm doing ribs a lot, then it would be.
As the detectives introduce specific allegations, Nassar becomes defensive, questioning why his actions are being scrutinized after years of practice. He shifts blame to his victims, suggesting they misunderstood or failed to communicate their discomfort during treatments. Detectives counter this by pointing out patterns in the complaints, subtly highlighting the number of similar accusations against him. This phase illustrates Nassar's use of victim blaming as a defense mechanism, a common tactic among perpetrators attempting to deflect responsibility. His refusal to acknowledge the emotional harm inflicted on his victims underscores his lack of empathy.
Well, the reason I'm asking is that we did have another complaint.
Really?
Yeah. And it's a patient from a while ago.
Okay.
And she does describe some things that sound to me like they're out of the norm from your typical treatment.
Okay.
This would have been in.
Wow, okay.
And she was receiving some of that type of treatment, but then there were also some other ways that she was touched that she could be on the treatment.
Okay.
So that's why I'm asking about anal penetration.
Only if there'd been coccyx, and I would have, and it would have been, because you can push hard. There's a lot of room down there, but I wouldn't have gone intra-rectal. You know what I mean? Like unless I was purposefully treating the coccyx itself.
Okay.
You know what I mean?
What would you use to do that? Like what digit or what part of your hand would you use?
Well, normally I'm using my thumbs. As I'm coming up this way. You know what I mean? Then if I actually have to fix a coccyx, then I'm going to be using my finger inside and my thumb on the outside to
do you wear
manipulate the
gloves when you do
coccyx.
that?
If I'm going to go intra, yes. You know what I mean? So.
Larry stutters as he answers whether he wears gloves when he performs the procedure. Nonetheless, his answer suggests that he does not wear gloves at certain times. This is against protocol since a doctor is always required to wear gloves when performing pelvic floor physical therapy.
This was a long time ago, so I don't know how many of your patients that you remember from back then.
Yeah, I don't, how many patients, right. Yeah, no, I don't remember,
Right.
No.
Well, this is a little bit of a personal question, so I'll just be totally honest.
Yeah.
You have these young girls in there. They're athletes.
But they're usually with their parents. They're usually with their, parents, So that's why I explain a lot.
They're athletes. They have lovely figures.
Right.
They're very cute girls.
Right.
Do you ever get aroused during these exams?
Do I get aroused during the exam?
Yeah, but do you ever get an erection?
Obviously you don't, you know what I mean? So,
is there a reason that you would during an exam?
I shouldn't be getting an erection during an exam.
Right. Well, this is why I'm talking to you about this,
Yeah.
because this young girl and her mother both observed this on more than one occasion during treatment.
That it would get aroused during an exam.
Visibly an erect penis. Not exposed, but through your clothes.
I can't explain that because that should, when I'm working, I'm working. You know what I mean? So don't.
Well, you can understand why this would be
Well, yeah.
a concern.
Yeah.
You know, that you didn't wear gloves.
Right, okay. But I mean, but I was like doing her coccyx. Actually digitalized the coccyx, like for coccyx treatment.
The words that she used were he anally penetrated me with his thumb.
No, see that wouldn't have been. See, I would never do that for the coccyx. I would use if I'm going inside, I'm using this. If I'm penetrating, it's not penetrating. It's pushing off to the
I
side.
penetrated her. Okay. Again, this was some time ago.
Yeah, but I'm lifting up and I mean it's not going inside her rectum. It's you can get there's a lot of soft tissue there, you know, and you're lifting through there. I would be wearing gloves if and I would be using this finger. Okay, when I'm using my thumbs, I'm lifting, you know what I mean, to try and separate the tissue and releasing through there. You know,
and this is what you're describing to me is very different than how she's describing her experience.
Okay.
All right.
Okay.
That there was no explanation of what you were doing to her or to her mother. And so you can see kind of the consistency from what happened a couple years ago.
Well, no, but okay. But I mean, okay, But I would be, I mean, like, that's why I have so many lectures and stuff. I mean, that's what I'm known for is my education. You know what I mean? So I don't.
Your education to
students.
To students,
Right.
but not necessarily
to patients. Why I try to. You know what I mean? Like I am. I'm like, I've never had anyone, you know, what's confusing me about is why wasn't there anything said back when I was treating them if they felt that uncomfortable? You know what I mean? It's like if I'm talking to the patient.
Okay, put yourself being a teenage girl.
Okay.
Larry adopts a defensive stance and blames the victim for not reacting if he was indeed abusing them. In his mind, unless the patient stops him, he is assuming the patient understands and is consenting.
All right.
Okay.
Most people that are sexually assaulted are very uncomfortable. They don't know what to say.
Okay.
They're in a position where they feel.
But the parent was right there. You said the mom was there?
She was in a different part of the room. She couldn't observe.
It's an exam room, a different part of the room. It's the same room.
Behind where you were.
Okay.
But I don't think that really the focus is why is it being brought up now. I think the focus
I'm just trying to think of what
it has been brought up, that there are discrepancies in what she's
Right.
telling me as compared to the technique that you're describing.
Well, yeah, but I'm trying to think of, I mean, you know, this is trying to think of what I would have been doing differently. That's a long time ago, you know what I mean, for me to remember everything. But there would be, like I said, what the discrepancy would be is I'm using my thumbs, that's not a discrepancy, to release around the coccyx, okay, where I'm actually lifting. Okay, so that's what I said. If I'm treating through sacral tuberous and not the actual, because I'm trying to release the tissues that come up to attach there, so I am pushing hard, okay, with my thumbs, okay, and I'm separating. Okay, so if you have thumbs over there and you're separating, but I'm not going in, if you're going inside you're going to be using your finger, okay, not your thumbs, and that's consistent with what I'm saying with what she said. So if I'm saying yes, that I'd be using my thumbs, how's that inconsistent?
Well, if your fingers, and pardon me, gesturing,
Right.
are doing some type of.
But my fingers are up here. My thumbs are at the coccyx.
Well, that's not how she's describing it. Now, your fingers are vaginally penetrating her.
What?
And then your thumb anally penetrated her.
No.
So I don't see where that falls in line with that technique.
Right, and I don't see how that would be accurate.
More than once, or more than one treatment.
I'm just working the floor, you know what I mean? But I would not be. How would I be putting my thumb and fingers, you know, like that? That would.
The interrogation intensifies as detectives present testimonies describing his inappropriate conduct. Nassar's composure begins to crack. He stumbles through explanations admitting to practices that deviate from medical standards, but framing them as necessary adjustments. He denies ever experiencing arousal during treatments, though his body language suggests discomfort when directly confronted with these allegations. Forensic experts would interpret this as a turning point where Nassar's confidence falters under the weight of evidence. His insistence on professionalism, despite mounting contradictions, signals an attempt to salvage his reputation.
Now, if there's some type of treatment where she's on her side, would you have any reason to touch her breast?
If I'm treating ribs, so if I'm treating ribs, that must have been, like I said, I would have been pushing and touching ribs, okay?
How would you touch her breast to do the ribs? I mean, demonstrate on yourself.
Right, you're moving the tissue out of the way. You're moving the tissue out of the way to try and get down between the breast and the rib. Okay, so you're lifting and shifting again because you're moving the tissue out of the way. So if I'm moving tissue out of the way, I got to get down to where where I'm making contact, with the rib. Okay, so you try and move and adjust. Okay, or the same thing here. If I'm on the head coming down, you're pushing down, or if you're off to the side, you're pushing off to the side. But you're there's ribs that are underneath that area, so you're trying to slide through and across.
Okay, that makes sense.
Right.
But this girl saw you 5 times, and all 5 times there was something that, with her knowledge of what that treatment was, because she had some knowledge of it, went beyond that. The touching of her, the digital penetration of her anus, touching of her boob, and she could visibly see at that time that you had an erection, that you were aroused. Okay, she describes your.
You will notice Larry is sitting on the edge of his seat. This tells that he is anxious and starting to feel cornered.
Demeanor, your behavior, your physical reactions, and being able to see an erection. Okay. So, I know it was a long time ago.
Right.
I'm here to get your side of the story because this is very concerning.
Well, yeah. I mean, I try my best to be appropriate, professional, you know what I mean? And I have no understanding of why that would be occurring, okay? Like, I'm a male, you know what I mean? But
has it ever happened in an exam or treatment before?
you are, I'm focused on my treatment, you know what I mean? I'm not trying to gain any type of sexual pleasure out of working with my patients, okay? I mean, that's what you're trying to ensue or whatever.
That's what I'm asking you.
Right, and I'm saying, no, I don't get sexual pleasure out of working with my patients. That's not what being a physician is, not what I'm about, okay? What I'm trying to do is release tissue and work through them, but I'm not trying to get my jollies out of this, okay?
So explain to me, like, when you're doing an exam, is it physically taxing on you?
Yes. Oh, yeah. Any medicine is physically taxing, yes. You know what I mean? There is no question about that. You know what I mean? Because you're moving body parts and you're pushing and you're really, and for me it's a lot of cerebral where I'm trying to visualize where the fascia is going, and pushing and moving. Okay, so I mean, I'm working my best to try and allow that treatment process to occur, and you're really trying to feel what's happening in the tissue. Okay, and yes, you're moving tissue out of the way. You're pushing in and separating. Okay, and you're trying to feel with one hand you're pushing, with the other hand you're monitoring to sense what's happening at the other end, and then you can compress and mobilize, but so I could see how people could feel, because there's a lot of tissue and I'm separating, but I'm trying to explain things while I'm doing things. Are you okay? Does that make it feel better? Like when I push them, like, does that feel better? Is that helping? You know what I mean? Am I pushing too hard? I'm constantly discussing that with them. You know what I mean? Like, does it help?
What would you say prior to doing this treatment?
What would I say prior to doing the treatment?
You're at a doctor, someone that you trust, and all of a sudden, his fingers are essentially in your vagina. And with no explanation.
I would have explained it. I don't understand why she said I didn't explain it, because I always explain, okay, now you're going to feel like pressure.
But you didn't explain it 2 years ago.
Yes, I did. Wow.
I mean, 2 years ago, she reported pretty quickly after it happened. She's not going to forget
Right,
that she
right,
received
right.
an
Good
explanation.
explain. I mean, that's what I'm saying is like, I don't, that's I'm like, okay, I'm putting pressure, compressing, separating, you know what I mean? Like I'm gonna, my hands are gonna be pressing on here and I'm gonna be pushing off to the side, or, if this hurts, let me know, but I'm treating it and just talking at the same time. You know what I mean? So as I'm going through it, it's not like I sit and explain everything to start with and then go do it. I'm talking through it too. You know what I mean? It's like, how does that feel? I'm getting real-time feedback from them. Okay, so as I'm doing it, like, does this hurt? Are you okay? Is that feeling better? Okay, so it's not like it's a dead silence and I'm just doing things. You know what I mean? I'm constantly talking, with them to get feedback. Okay, did they say anything about that?
Some of his victims would claim that even when they told Nassar what he was doing hurt them, he would continue doing it regardless. He failed to explain the procedure before performing it, and many said the treatment was never listed on their medical charts.
But that's what I do. I'm constantly talking. Does that make it feel better, make it feel worse? And I'm adjusting based upon that.
Would there be a situation that you wouldn't wear gloves during an exam like that?
If I'm I will wear gloves if I'm actually like manipulating the coccyx. You know what I mean? Because you're going into rectal. You know
what
I mean?
if you're going vaginally or even just outside?
Well, if I'm just outside, no. You know what I mean? Yeah, I even say that on the thing. As long as you're staying external. You know what I mean? Because you're external. Okay, and you're sensing, you're using to push, to lift and shift. Because you're staying. You know what I mean? Like you're staying lateral to that. So you're pushing in central and then lateral. Okay. So, but so if you have like the vagina here and you're coming here pushing, you can see how you could like feel, or they may have as a teenager having that sensation. But I'm not going intravaginally. I'm going extravaginally, but pushing in through the pelvic floor. Okay. So this is the pelvic floor. You know what I mean? You're here and coming over. There's tons of room there, okay? And so that's what I'm saying is like that as I'm doing that, I'm asking them, are you okay? Am I pushing too hard? Is this hurting? You know what I mean? Do you feel better up there? Am I monitoring hand?
Did you ever ask them if it feels good?
Feel better or worse? You know what I mean? Does that feel better? You know what I mean? Are you doing okay? It's always better, because I'm trying to see, okay, remember I said about the different adjustments, because do I need to go this way, or that way? It's based upon how they're responding and how I'm sensing the release, because I can sense the release, but I can't sense their pain. You know what I mean? And are you okay? You know what I mean? That's the thing that's very irritating to me, is that if I'm asking the patient, for feedback when I'm doing it, that's how I always feel like I'm okay, because I'm like, are you okay? Are you okay? Like you're talking real time, with them. Okay. Am I pushing too hard? Is this hurting? Like this, because you don't want to push too hard to hurt them. You know what I mean? So, does that feel better? Feel worse? You know what I mean? And then they respond. You know what I mean? I hope, you know what I mean? So, but that's what is frustrating to me, is trying to get an understanding of why there was that lack of communication. You know what I mean? But when you're talking to them in real time, you know what I mean? Like I'm asking their feedback.
But in a situation where you weren't talking and they didn't know what you were going to do to them because they had no prior explanation, I mean, would a girl that young speak up?
When you're trying,
if she's wondering if she's not feeling okay, but she thinks it should be okay, and thinking about it later, then she realizes that it was not okay with her. I mean, there's lots of reasons why people
I can see that,
And then seeing that you're erect and feeling on more than one occasion and feeling very uncomfortable.
Yeah, well, it'd be nice if I had, whatever. I mean, I can't speak for her, but if the parents also and her felt that, it'd be nice if there was some communication where I'm asking for communication. You know what I mean? So, but that's.
And we can't go back to having that. But this situation as it is, I mean, there are some things that, even to me, hearing you explain it one way and hearing how she explained receiving the treatment is very different.
I'm trying to
Well,
trying to explain it, you know what I mean, the best that I can.
right.
You know, I mean, I'm trying
But
to...
for her, she very vividly, you've done it hundreds, maybe thousands of times.
Right.
Her, she done it 5 times, and it's very vivid to her
Okay.
how she received
The
what you
treatment.
presented as treatment, what she felt very different as.
Okay. And did she ever make any, I would assume not, otherwise I would know, you know, like concern, you know what I mean? Like, did I ever like ask her something and say like, does this hurt, and then not adjust it or not listen to what she was saying? You know what I mean? Like the feedback, would I respond to her feedback? And was she telling me she was getting better? Well then, yeah, I mean because that's how I'm asking, you know, like for feedback, I want to know, you know what I mean, am I helping, am I not helping, you know what I mean, and that's, and it's made, like I said, even with, be able to continue standing and walking and doing our job, you know what I mean, it is very personal, you know what I mean.
And it's also received very different when you're doing it on someone from the medical profession who has a lot more knowledge of what you're going to do.
Right. I can't talk about something I don't know the situation. You know what I mean, like from that long ago. But that's what I try. I do this all the time. You know, I talk to people. I'm trying to get feedback, and I'm trying to go off of their feedback. You know, and there's like this trust too on my part of that I'm trusting them to tell me if I'm hurting them, if I'm pushing too hard. Are they getting better? You know what I mean? Like that's part of the only way that I can really know, you know what I mean? It's like, is by having the feedback, you know what I mean? And I hope they said that I was asking them and trying to ascertain how their comfort level is, you know what I mean?
In some ways.
You know, because that's, the last thing I want to do is hurt someone, you know what I mean? And so if you're concerned because you're in their private area and you're asking them questions, and if they're not giving you the feedback, then how do you know that if you're saying, am I hurting you? And they say no, then how do I know that I'm hurting them? You know what I mean? And I'm trying to be...
Detectives escalate the pressure by introducing accounts of Nassar's interactions with patients' parents, who were often present but unaware of his actions. They focus on the deliberate concealment of his behavior, such as positioning himself to block parents' views during exams. Nassar continues to deny intent, claiming procedural necessity and dismissing victim accounts as misunderstandings. This stage reveals Nassar's reliance on authority and trust to carry out his crimes. His evasiveness and repeated denial of wrongdoing reflect a deep-seated belief that his status shields him from accountability.
Treatment. But in a different situation, and I think what concerns me here is the visible signs of your arousal, where this young girl is afraid.
Well, I don't want people to be afraid, obviously. And I was trying to, you know, with my patients, I'm trying to actually help them, not hurt them. Okay? You know what I mean? That's, you know, that's the bottom line, I guess you could say. You know what I mean? Is that's my goal, you know what I mean, is to help them, not to hurt them.
And so, just to clarify, you're saying that during these visits, these treatments where you're dealing with young to old teenage girls who are very physically fit, very attractive, that you don't get aroused when you're touching. I mean, you're essentially touching their genitalia, touching their breasts.
You know, I'm not purposely trying to get arousal from doing any treatment. I mean, come on. You know what I mean? I'm not purposely trying to gain some type of sexual gratification out of doing that. That's not what I'm doing. Okay? You know, if there was arousal, it's you know what I mean, like it would be because of whatever, I don't know, but I'm not trying to, you know what I mean?
Whatever, I don't know.
Well,
I don't
you
know.
When you're a guy, sometimes you get an erection, you know what I mean? But I don't, that's
You
what I'm
get
saying.
an erection when you're aroused.
Yeah, but you know what I mean? Like I'm just saying that, you know, If I had an erection, I understand why I would have an erection from doing the treatment, you know what I mean, from what I'm doing, okay? And that's rather embarrassing, you know what I mean? It'd be rather embarrassing, okay? I mean, to have that happen, okay? So it's just like, you know, that's not appropriate, okay? And that is just not professional, you know what I mean? I don't know how else to explain it, but that's, you know, yes, you're a guy, you know, but you know, I'm trying to not, and yes, they're young ladies, but I'm trying my best to be professional, you know what I mean? That's why I'm talking with them too, is I want that feedback, I need that feedback, because if I don't, then how do I know that I'm, you know, if I'm in their area and I'm talking to them and asking them, you know what I mean? It's constantly asking them, you know what I mean? Like, then I feel like, okay, they're giving me the positive feedback. If they're not, I adjust, you know what I mean? So how can you not, if someone is telling you you're okay, how do you know you're not okay? I mean, like, if you're getting real time, are you okay? Is this helping you feeling better? Okay? And then if they say, so, you know, if I'm not getting that feedback, how do I know that I'm not, but then they find out that I'm hurting them, that's bad feedback. That's not what, you know what I mean, what I'm...
Do you do a similar adjustment or technique on male teens?
Yes, exactly. Whether they're male or female, it doesn't matter. You know what I mean? That's the same thing, you know, because you're still having to treat the sacral tuberous or what have you. Yes, I mean, whether it's a male or female. Okay. Yes, you know, and it's just what can I say? The thing that is most frustrating is that the amount of conversation that I'm trying to have with the patient to try and prevent this from happening, okay, is important. And if I'm asking a patient, does this hurt? Or is it helping? You know what I mean? And they don't tell me the truth. How do I know then that I'm hurting them? When I'm doing this real time, you know what I mean? Like, I want that feedback, and I adjust based upon the feedback. Okay, and I think that's the part that I'd like to, you know, have some information about. You know what I mean? It's like if that's the whole protective mechanism, so that I'm not harming someone, you know, so that there's real-time feedback.
Right.
Okay.
I understand what you're saying about the feedback, but I think there's a difference between, like, physically hurting someone and then them feeling touched inappropriately.
Right, but
and I think that's a different scenario of a comfort level to give feedback.
But that's hurting, though. I mean, but that's hurting. I mean, like, if you're doing something inappropriate, that's hurting. That's not helping. You know what I mean?
Well, hurting mentally. But it may not be causing them physical pain.
Yeah, I mean, but there's a comfort level. You know, if you're doing something and you're asking them...
Have you ever had someone do something that made you feel uncomfortable and you doubted saying anything?
Not, you know, like you mean like...
Anything. It doesn't have to be physically. Anything where you thought, I don't feel right about this.
Yeah, you get your
feeling.
gut feeling. Yeah. I see what you're saying.
And your instinct was probably correct.
You know, your gut. Well, you know, I mean, but that. I don't know. I'm just saying. Yeah, you have your sense. You know, I mean, everyone has like a sense about them. You know, but.
I was going to give you a business card, and I realized that I don't have it. I'm going to go grab one and give you a moment to think and see if you have any other questions for me.
Yeah, I want to know what's going to happen. You know what I mean? Like I'm very.
I think similar to last time, obviously the university has to be notified. I have no control over that.
Right.
So I'm sure there will be conversations with your dean or whoever, however that looks. I'm sure you're familiar with that process. We don't get super involved in those processes. But, and then I will continue to investigate.
Okay.
There will be other witnesses to talk to, things like that.
Okay.
And so, like last time, there will be an investigation.
Right.
Okay?
Okay.
All right, I'm going to go grab a card. Just so that you can have my information. I'll be right back.
Okay.
After the detective leaves the room to get her business card, we get a glimpse of a worried and frightened man. Larry sits alone in the interview room, pondering for several long, silent minutes. He sighs, puts his head down, and sits completely still as he waits for Detective Munford to return.
Read over their business card. Before I forget, I'll give you one of those as my email, and also the phone number that I left for you.
I don't know how to explain it more than what, I mean, like, I can't go back in time and remember that far, okay? But I'm telling you, honestly, it is, I'm trying my best to help the patient. I'm trying to get real-time feedback from them, okay? And I've helped so many people, that it hurts my brain to think that someone would, as I'm talking to them, I just don't get it, because I'm trying to prevent that. I don't want to hurt someone, so I'm trying to get real time. Am I helping? Am I not helping? And I try and adjust based upon what they're saying. And so it's hurtful for me to think that I've hurt someone. That's just not who I am. Okay, and I'm trying my best to figure out how I didn't read the situations, because that's, you're trying to assess comfort level, too, and
Immediately, Detective Munford re-enters the room. Larry starts defending his actions. He acknowledges that the girl who filed a report might be hurt, but that it was not his intent to do so. Larry realizes that his situation has become worse and appeals to his good nature.
I obviously offended her, there's no question, and that's not good, and I don't want to offend anyone, that's not the intent, that's not the purpose, and I'm trying to do the feedback to know if I'm making a difference or not, and so I usually leave feeling good because I'm helping someone,
What would you say if I told you that there may possibly be other complaints?
I'm doing this treatment a lot, so,
But why would there be those consistent complaints?
You work down there a lot, if I'm working there a lot, okay, what's gonna...
But if repeated girls are saying that you're not explaining the process and that...
But I feel I'm explaining the process. They may not be understanding it, but I think I was explaining the process. If I'm explaining it and they're not understanding it, then you would expect that they ask for more information.
Have you had other complaints from patients?
No, just the one, I've had to explain things to patients,
But if they afterwards said, I feel like you invaded my space, but I violated...
No, nothing like that.
Okay. About how many times do you think you've done this procedure?
It'd be thousands, over the years, because it's been a long time, that I've been doing it, so, and like I said, I lecture on it, and it is invasive, and I'm trying to explain things, and that's what bothers me, is that, if I'm talking to people and asking them, for their feedback, and if I'm getting feedback that says it's okay, then it's okay, it's like I'm asking permission, am I pushing on you too hard, is it hurting, and I'm adjusting, and so that's the concern that I have, is so it hurts me to think that I'm not, that by talking to my patients and trying to interact with my patients, that I'm saying one thing and they're telling me something, but they're afraid to tell me the truth. And that's hard, okay? Right. That they're afraid to tell me the truth. It's like, well, what's, just give me the feedback, and I adjust. That's the whole thing, is getting that adjustment. That's what hurts. It's like, because it's like blindsiding someone. It's like, if you're doing this and you're doing it for good to help someone, and they're giving you the positive feedback that you're helping them, how do I know I'm hurting them if I'm getting the positive feedback that I'm helping them? And they're telling me that. Like you said, she said, yes, it feels better, but she then wasn't feeling better. You know what I mean? So how do I know that? You know what I mean? Like, unless, so if you...
I think emotional pain, though, is different. And I think you keep talking about helping the physical pain,
Right,
the cause,
right.
that brought her there.
Right.
But emotionally, she's not getting help from this. She may be getting some physical because you are doing, in part, the treatment.
Uh-huh.
Her pain is somewhere else.
Well, yes, I mean, if she thought that I was being inappropriate, I could see how that would be painful. You know what I mean? And I don't want that. You know what I mean? That's what I'm trying to be. You know, you can explain something and then go ahead and treat it. But if you're actually talking to them while you're doing it, it's better than, in my mind, than saying, you know, that, because I'm trying to get real-time feedback, not here's what I'm going to do, then I go do something different. If I'm actually touching the patient and asking for feedback while I'm touching the patient too, you know what I mean? That allows for, in my mind, more, you know, like feedback than here's all the information, then you stop the information and you go do it, and then you don't get any feedback.
So if a patient
feedback,
stopped you and said, this feels inappropriate.
yes, then of course I would adjust. I'd say I apologize and I'd try and explain more. Okay? You know, this is what I'm doing, this is the reason why, you know what I mean, that I'm doing what I'm doing. Okay? So you're gonna adjust and explain. You know what I mean? So yeah, if anyone says that it hurts or, you know, I feel uncomfortable, you know, then I say, okay, let's try a different way. You know what I mean? Let's do this and I'll explain this, you know, to them. Mm-hmm. So, you know, I've done a lot of work with, you know, like I'm trying to also, like, if there was patients that I think needed more, I use a pelvic floor therapist. You know, it's like if they need that type of help, I have a pelvic floor therapist that I'll send patients to. You know, there was one patient who came up from that has and she had this problem with her. This was just in the past few months, and it's like, you know, you're a peer, aren't you? You know what I mean? Because gymnasts pee a lot. You know, they have weak pelvic floor. You know, and so we're always working like, okay, you got to learn how to use your pelvic floor to squeeze to help with the core. It's like the floor to the core. But anyways, so I was like, you know, you have no tone down here. You know what I mean? Are you a peer? And she goes, yes. And so I had her go to a therapist and gets intravaginal and intrarectal work, you know, the pelvic floor, I mean, intravaginal and intravaginal work, and her spasms, her calmness went away, you know what I mean? It like changed, again, it made a big difference for her, you know, but that's when I use other therapists to help with that, okay, because that can make a difference, okay, but that's when I use those pelvic floor, the physical therapists that have training in pelvic floor work, you know.
So do you stay in contact with a lot of your patients after treatment?
A lot of my patients, yeah. You know what I mean, over the years, because they'll come back, you know, I'll see them again, and for a different injury, or, you know what I mean, yeah.
Do you initiate a lot of the contact with them?
No, I never initiate, they initiate the contact.
Okay. I don't really have any other questions right now.
Okay.
Okay. What's the best number to call you if I need to?
Let me give you my cell.
And if what you call. Okay. And that's my information. Like I said, I think that the Dean will probably want to speak with you soon.
Right.
Not something I can control.
Right.
But I may have more questions from you, and then I'll get a hold of you, so I don't have to call your home or your work.
Okay. All right. Well, thank you. I don't know what else to say, but I'm not trying to hurt anyone, and I must obviously not be doing a good job of explaining things, and I really feel like I'm trying to real-time explain things, and it's obviously must not have worked. You know what I mean? So, but that's the best I can say, is that I'm trying to get real time, and if I'm offending someone, I would expect that as I'm treating someone, they would say, that hurts, or that makes me feel uncomfortable. You know what I mean? And then you adjust and say, okay, I'm sorry, let me explain it to you, and you adjust. But if they give you positive feedback, then you think you're doing something that's helpful. But so, all right, well, thank you. I'm sorry. All right, well, have a good day.
The detectives confront Nassar with the sheer number of allegations, emphasizing the improbability of so many similar accusations being false. His responses grow more erratic, alternating between pleas of misunderstanding and defensive outbursts about his dedication to patient care. Detectives subtly suggest that a full confession might alleviate his situation, but Nassar remains adamant in his denials. Forensic analysis highlights the psychological toll of the interrogation on Nassar, as he grapples with the realization that his justifications are unraveling. His refusal to confess indicates a continued effort to maintain control over the narrative.